When should a newly diagnosed patient consider starting treatment?
So when should an individual who's been diagnosed with myeloma consider starting treatment? So there are a number of criteria that we use to determine that a patient has what we call active myeloma that requires therapy. And traditionally, this has been one of what we call the CRAB criteria. CRAB is a mnemonic that stands for elevated calcium, for renal dysfunction, meaning kidneys not working properly, for anemia, which is a low hemoglobin level, and the B stands for bone lesions, if you have abnormalities in the bones. And traditionally, if patients have a diagnosis of myeloma and have any of those four features, that would lead us to start treatment. And so that's a definitive reason to start. In addition, there now have been 3 additional criteria that have been identified that predict for a high likelihood that the patient is going to start to have symptoms, even if they feel perfectly well right now. And those criteria are called the SLIM criteria, SLM, and they stand for 60% plasma cells in the bone marrow. They stand for an elevated free light chain level in the blood with a ratio more than 100 to 1. And M stands for MRI if there are multiple focal lesions on an MRI of the spine and pelvis. And based on several studies that have been done, if a patient has any of those 3 criteria, even if they don't have the CRAB criteria, there's evidence that they may benefit from starting therapy earlier. And so therefore, we often will advocate for starting treatment in those patients.
The most common question I get from patients is, well, when do I have to start treatment? What level do we start treatment? Does my IgA have to get to 1,000, 1,500? Does my monoclonal have to get to 600, 800? Do my light chains have to go 200? None of those things are relevant. It's really the slope of this curve that is more relevant. Hence, my favorite patients are engineers and accountants, because they love graphing their monoclonals and their light chains. They look at this and I say, the slope, well, obviously you need to get treated when the slope of the curve changes, to which 90% of my patients say, what's a slope? And I was like, rise over run, man, but this is what it is. So over here, this is when you want to think about treatment, because this is the time that you have symptoms. Now, this patient is put this way because this patient in general has low-risk myeloma, meaning they're more likely to be sensitive to chemotherapy, and they're also more likely to have a prolonged wake-up period. So the majority of newly diagnosed patients are those that have come to evaluation from a healthcare provider because they have symptoms. They have fractures, anemia, and kidney failure. And on average, we should try to treat them as soon as humanly possible, and much sooner than many patients often get the opportunity to be treated. We would love patients to, if they get diagnosed with fractures, anemia, and kidney failure in the hospital, that they start treatment in the hospital immediately to prevent further damage and to allow recovery of those organs that are damaged. But that's not always the case. Some patients meet criteria for myeloma, sometimes the so-called SLIM criteria, greater than 60% plasma cells, greater than 1 focal lesion on MRI. These patients, or a light chain ratio greater than 100, these patients have met criteria for myeloma diagnosis, but they have a 75% chance of developing CRAB criteria in 2 years. Those patients, they're different. They're not clinically sick at the time. And so you may have a moment to think about it, delay a bit, think about, is there a clinical trial close? Think about the timing for the patient and try to decide and kind of get your ducks in order before starting treatment. So for those patients, you have some flexibility, whereas those patients who will have fractures, anemia, and kidney failure and in the hospital, you want to get them started right away.